I know how early detection improves prognosis and gives better results. Most men find it difficult to seek for help, especially when it affects their sexuality and masculinity. 2 months ago, I received a call from a friend. He has an unusual pelvic discomfort. I know how much men struggle with this type of discussion and how they want to feel well. So I referred him to see a urologist who ordered PSA, prostate specific antigen scan, urine culture, and X-ray. He was diagnosed of prostatitis. I sat down with him for a discussion. When did this all started? He said about 2 to 3 months ago, he answered. From my discussion, I found that he has been ignoring his health for a while. His diet, exercise, and rest. I have been busy with work, course, projects, while trying to survive the economy and also saving as little as I can. He said, I told him, I understand the economy is harsh, but if you neglect the body that takes care of all these projects, you will break down. You can see how rapidly your health is declining within these few months. Yes, up to 50% of men experience prostatitis, especially between 30 to 50 years of age at some point. So this is Ozioma Okonkwo, also called Ozitich. I am a registered nurse, a public health nurse. In this video, you will learn what prostatitis is, causes, type, and how to prevent it from reoccurring in case you have it, or how to prevent it from occurring at all. So this video could change your life or even save your life. So what is prostate? Let's begin with that. It's a small gland in men about the size of a walnut that sits just below the bladder and wraps around the urethra, which carries urine and semen out of the body. The job of prostate is to produce fluid that nourishes and transports sperm during ejaculation. So think of prostate as a little fluid factory that keeps the sperm happy and moving. So what is prostatitis? Prostatitis is when this prostate gland gets swollen or irritated. It is important that your prostate stays healthy because it determines your fertility, sexuality, and overall health and well-being. So what are the types of prostatitis? We have the acute bacterial prostatitis. This occurs suddenly due to bacterial infection. Yes. Anytime you hear acute, that means a sudden infection. A sudden infection. And it comes very quickly. Symptoms likely to observe with this type of prostatitis include high fever, chill, severe pain when peeing, urgent need to urinate, lower back pain or groin pain. This type of prostatitis needs urgent medical intervention. See your physician who will order diagnostic tests and place you on antibiotic which your body is sensitive to. Please ensure you finish the entire course even when your symptoms improve to prevent prolapse or progression of this acute prostatitis to chronic bacterial prostatitis. The next type is chronic bacterial prostatitis. So it's a slow progressive bacterial infection due to recurrent acute prostatitis that has not been treated very well or relapsed. Symptoms to watch out for: patients with chronic prostatitis will have recurrent urinary tract infection, pain, discomfort in the pelvic, or other urinary symptoms like urgency, frequency, and nocturia. Urologists may place you on long-term antibiotics about 4 to 6 weeks ago to help eradicate this bacteria. Yes. Another type of prostatitis is chronic pelvic pain syndrome. This type, the cause is unknown, but may involve muscle tension or past infection, stress. Symptoms to watch out for: pelvic or perineal pain lasting for 2 months or more, urinary discomfort, sexual dysfunction. Patients may have no bacteria in their tests, especially when they do urinalysis or urine culture. The urologist may place them on pain relief, muscle relaxant, physical therapy, stress reduction, and it's very important you adhere to this to help relieve symptoms. The last but not the least is the asymptomatic prostatitis. So, asymptomatic prostatitis is inflammation of the prostate without symptoms. Yes, he was diagnosed with chronic pelvic pain syndrome, and I know for sure how lifestyle, diet, and stress has attributed to this. Never ignore these signs. During this pain, his quality of life decreased. He was absent from work. And I know how much men prefer to do going to work, especially during this summer period when the kids are on holiday. What can increase one's likelihood of having prostatitis? 1. Bacterial infection. 2. Stress. Stress reduces your immunity and increase your risk for getting infection. Dehydration. Holding the urge to urinate for a long period of time can lead to it. Sedentary lifestyle, poor diet, alcohol, diabetes, age, 30 to 50 years of age, smoking. These are risk factors that can help contribute to prostatitis. So how do we prevent this from occurring? Prevention is to maintain prostate hygiene, stay hydrated, urinate regularly, don't hold the urge to urinate. Eat food that supports your prostate health, like tomato, green tea, vegetables like pumpkin, probiotics, omega-3 rich food, stress reduction, exercise, moderate, safe, protected sexual activity will contribute to a good prostate. Not excessive, not multiple sexual partner. Moderate, moderate, moderation will contribute to a good prostate. Men, I know how hard it is for you to talk about health and sexuality with someone. But when it comes to your health, it is better to speak up to get better solution than hide the pain and struggle inside. Remember, your pain is valid. Your health matters. Don't ignore. Don't suffer in silence. Take action today. If you have followed me to this point, don't forget to like, share, and subscribe. Please comment real health talk if this information is useful and it drives home. If you want to see more on health related topics, or if there's any topic you want me to cover, please put it down on my comment section and I will see you in my next video. Don't forget, your health matters.